Good morning, good afternoon, good evening, everyone. Welcome to the first webinar of the IANPHI Africa Webinar series of 2022. Wherever you are, Happy New Year and welcome to 2022. So today is the IANPHI Africa Network. And the first webinar is going to be on wastewater surveillance programs for COVID-19 and other pathogens led by African National Public Health Institutes. This is going to be a series of webinars. We actually had some webinars before, and all of you actually know what COVID did. Interrupted quite a number of things, but I want to thank IANPHI team for keeping vigilant all the time and waking us up, even where things had probably gone awry. So today's webinar will be moderated by Kieng Mercy. And I have the privilege to introduce Kieng Mercy, who is an event-based surveillance lead at Africa CDC. Now, Kieng Mercy Tetu is an epidemiologist with over 10 years experience at the national, regional, and continental level, strengthening health systems in detecting and responding promptly to public health threats. She currently leads the event-based surveillance program of the Africa CDC, which is supporting the establishment of early warning systems using epidemic intelligence to improve early detection and reporting of public health threats. Her work involves building capacity on event-based surveillance on the continent and leading the development of event management systems for the capture, analysis, retrieval, and reporting of both structured and unstructured data for Africa CDC and African Union member states. Kieng Mercy also doubles as the focal point for health information exchange with Africa CDC, through which she leads the development and operationalization of the AU Health Information Exchange Policy and standards for health systems in Africa. With guidance from this policy document, she is supporting AU member states to digitalize data capture and reporting while also enhancing data integration, data warehousing, access and use to facilitate generation and evidence for decision-making, response, and strategic planning. Before joining Africa CDC, Kieng served as the Executive Director for Value Health Africa, where she developed and coordinated projects on early detection and reporting of national priority diseases, benefiting over 100 communities in Cameroon. Kieng has visited Uganda before. I've personally known her. So Kieng, proceed with the moderation.
Thank you so much, Dr. Alex, for that wonderful introduction. I'm really humbled. So colleagues, again, a big welcome to everyone on this webinar. It's an honor for me to serve as your moderator for today. Just a quick housekeeping rules. We are delighted to have simulation interpretation in French and in Portuguese. This is thanks to support from the US CDC. For you to be able to access this interpretation services, just kindly click the interpretation icon at the bottom of the Zoom screen and select your language. Also, kindly feel free to use the chat pane to share comments and ideas related to this discussion. To ask questions, you are kindly requested to use the Q&A box. And kindly also note that with your permission, the webinar is being recorded. And the recording and all speaker slides will be made available to you after the webinar. Before we get into the crook of it, and I would like to share with you a brief background and also the objectives and finally the agenda for this webinar. It's important to note that Africa CDC recently published an enhanced COVID-19 surveillance strategy at the community level. And one of the recommendations that stemmed up from this strategy was for African Union member states to enhance existing COVID-19 surveillance to include wastewater surveillance that will support in the monitoring of an early detection of environmental signs of virus transmission and identify communities where targeted interventions can be implemented to decrease transmission. In a nutshell, identifying hotspots where transmission is occurring. The objective of this webinar is to share experiences, progress, and recommendations on existing wastewater surveillance programs for COVID-19 and other pathogens led by African National Public Health Institutes on the continent. Also, to support National Public Health Institutes to be able to monitor wastewater for SARS-CoV-2. And as this has also been proven to be very, very efficient in and useful during a pandemic to detect new variants, track trends, and also identify hotspots. We hope that this session will encourage other national public health institutes in the region to consider implementing their own wastewater surveillance programs. As concerns the agenda for this workshop, it has been split into 2 sessions. The first part of this webinar will have a speaker from Ghana Health Institute, Ghana Health Service, sorry, and South Africa's National Institute for Communicable Diseases, who would share with us a presentation on their experiences and also provide some recommendations based on their best practices. The second part of this webinar will be a question and answer session where participants will be given the opportunity to ask questions and also the opportunity to the presenters to respond to these questions. So kindly feel free to drop your questions in the Q&A box during the presentations, or you can also have the opportunity to raise your hand during the Q&A session. So right on, I'm gonna introduce the first speaker for this webinar, who is Dennis Owusu, a senior public health specialist and Deputy Director of Surveillance at Ghana Health Service. Dennis is a senior public health specialist and the Deputy Director of Surveillance in the Ghana Health Service, where he leads in the planning, implementation, and monitoring of diseases, and monitoring of disease surveillance activities in line with Ghana's integrated disease surveillance and response strategy. Dennis will be presenting on Ghana Health Service pilot program on wastewater surveillance, the progress made and recommendations, just so this could serve as a benchmark for other national public health institutes in the region. This program, it's also important to note that this program he's presenting on received support from the Bill and Melinda Gates Foundation. So I would pass it on to Dennis to share his screen and comments with this presentation. Welcome, Dennis.
Right, so thank you very much for the introduction and for the opportunity to share our experiences as a country as far as the issue of wastewater surveillance for COVID-19 and other industrial pathogens are concerned. So this is going to be the outline of my presentation. We'll have a brief background, look at environmental surveillance for polio in Ghana, reviewing the criteria and some findings. We'll also look, as you mentioned rightly, the wastewater surveillance for COVID-19, which we did focusing on the objective rationale and some findings as well. And then we'll conclude and make some recommendations on way forward. So Ghana, as you can see with the red coloring, is on the western coast of West Africa, for those who may not be aware. We've been implementing integrated disease surveillance and response strategies since 2002 for all diseases that we prioritized, as well as other conditions and public health events. Polio is one of them. So we've been looking or doing surveillance for polio for a while, and environmental surveillance has been added as a key strategy. So that's one experience that we have on board as far as wastewater or environmental surveillance is concerned. We started this in 2016, and I'll go into more details in subsequent slides. We've also done some surveillance for COVID-19 using wastewater and in the pilot, as was highlighted during the introduction. And we'll give briefly some of the things we were able to do with that and the things we intend to do beyond that. So we started, as I said, in 2016 with 6 sites in 2 regions of Ghana. We have 16 administrative regions, and we've done it since 2016. Following an external review of our acute flaccid paralysis surveillance in Ghana in 2017, it was recommended that environmental surveillance be included in our routine activities as far as polio surveillance is concerned. And so we currently have 14 polio environmental surveillance sites, expanded from 6 in 2016 to current 14, and that's in 7 regions. So the map on the right shows various locations. So the red dots indicate the locations of these environmental surveillance sites. And the selection were based on some criteria, some of which are put there, including the availability of a sewer network, and also the poor performance as far as acute flaccid paralysis surveillance performance indicators are concerned. So these are some of the things that informed the selection of these sites for environmental surveillance for polio. And this is showing what we did in 2021. And as we can see, so for the various sites by names is on the extreme left. And then for the epidemiological weeks, the various weeks when samples were collected and the findings. So, and as we said, we'll share the slide. So please can go into more details to see what the findings have been. But as we can see, for most of them is either the deep green, which meant that there was no isolate, or the turquoise where we find non-polio viruses. And so these are generally what we found for 2021. But I have to say that in 2019, we did isolate circulating vaccine-derived poliovirus isolates from an environmental surveillance site. And indeed, beyond that, we've been able to identify 15 such isolates from 8 of our sites. So that fitted in quite well with the outbreak of circulating vaccine-derived poliovirus in some districts in the country. So it highlights the importance of environmental surveillance, not just for risk assessment, but also to also inform our public health response measures. So these are some pictures showing officers working in various locations as far as sample collection for COVID polio, I should say, environmental surveillance with polio. And part of our expansion also meant that we had to build capacity for the various locations. So this is just some pictorial representation of those trainings, as well as site visits during the training programs. So we move on to COVID-19, and as we mentioned, this was a collaboration with the Water Research Institute of the Council for Scientific and Industrial Research in Ghana, and with the Center for Global Safe Water, Sanitation and Hygiene at Emory University, and also with Training Research and Networking for Development. And this was with support from the Bill and Melinda Gates Foundation. So it was to develop a strategy for wastewater surveillance specific for COVID-19 in low-income urban settings with mixed sanitation solutions. And I have to highlight this, that comprehensive sewage systems is not the norm in Ghana. It's mostly individual. So you don't have a network of sewage systems, save for a few planned communities. And indeed, there's only one city that was well planned, which you can say has a centralized sewage system. So for most areas, it's individual or public latrines. So these were what informed the kind of strategies that were used to select sites in the Greater Accra region for a pilot. So various approaches, stakeholder engagement, we also mapped our study sites. There was capacity development as far as wastewater surveillance is concerned. Then the sample collection and analysis for the 2 study sites. So these are the methods that we use, the grab samples and also the more swab sampling. Now, we'll look at the first site. This is the urban community where I indicated has a centralized sewage system. So we can see the sewage lines and the various sewer points where samples were collected. And to the right, we can see the findings. The upper part where we see the red and the blue dots. The red dots indicate isolates of SARS-CoV-2, and the blue dots indicate no findings or no isolate for those sites. And then the two charts at the bottom show the cases, reported cases of COVID-19 for similar dates. And as we can see, to the extreme left of the chart, we can see that there were cases, but those points we are not collected any samples. But from when samples were collected, if you juxtapose that with the reported cases, we can see that as we report more cases, there's evidence of isolates in environmental samples as well that was collected from wastewater. So that was surely indicating the relevance of this as far as taking the necessary public health actions. This is the other site where it's not a comprehensive sewage system. It's mostly public latrines. And so public toilets were the sources for collecting this data. And again, we can see from the charts on the right that where the red dots are, we have cases in those communities as well. So there's some concordance as far as this is concerned. And if we go to the extreme right, we see that when there were no cases, it was also a reflection as far as the environmental samples are concerned. So this just indicated, and looking at the two different settings where we have a well-planned sewage system and also a poorly planned one, we were still able to pick evidence of SARS-CoV-2 in the environmental samples. So we're saying that as far as environmental surveillance is concerned, Ghana has used that as an integral part of our polio eradication efforts. And it's been a useful indicator for public health risks. Our experiences as well from the environmental surveillance sites using wastewater surveillance for COVID-19 has also indicated that it's something that we can be able to do quite well. And this is informing further actions such as looking at genomic sequencing, for example, and we have support to move the project to the next level with some funding from the Rockefeller Foundation. So we're hoping that we can be able to take this a notch higher and to be able to do this further. We're going to also, beyond this, look at exploring. These are some things we are thinking about. Integrated environmental surveillance, where we look at other pathogens such as Vibrio cholerae and others, and also strengthen laboratory capacity for environmental surveillance. And in all of these, we want to look at integrating data repository so that it can support effective decision making. So at this juncture, I want to end and thank you all. I want to acknowledge all staff of the various sites, the Noguchi Memorial Institute of Medical Research, which serves as a national polio laboratory, and Mr. Kwame Achempema, environmental surveillance focal person, IANPHI for this opportunity, and also Habib Yakubu of Emory for his support in preparing this presentation. I thank you very much.
Thank you so much, Dennis, for such a great presentation. I see you've lighted up the room for an exciting conversation ahead. Dear colleagues, kindly continue to put your questions on the Q&A box, and we'll be happy to present them to our experts after the second speaker. So we are going to move straight on to the next speaker. Our next speaker for this webinar is Dr. Kerikan McCarthy. Dr. Kerikan McCarthy is a pathologist at the National Institute for Communicable Diseases in the Center for Vaccines and Immunology. Presently, her main areas of interest are the development of wastewater-based epidemiological surveillance for SARS-CoV-2 and strengthening surveillance for rubella and congenital rubella syndrome. Kerikan has worked on a number of communicable disease programs. At the NICD, From 2015 to 2022, she was responsible for outbreak investigation and management, including support for the South African SARS-CoV-2 pandemic responses and the listeriosis outbreak from 2017 to 2018. Whilst at the Aurum Institute and with HIV Research Institute, she worked on tuberculosis and HIV public health programs. Kerikan will be presenting today on wastewater-based epidemiological surveillance for SARS-CoV-2 by NICD and the SARS network. So I would now want to hand over to Kerikan to share her slides and take up with the next presentation. Over.
Thank you, Mercy, and good to be able to share. Thank you for the invitation to represent the NICD in this forum. IANPHI has played an important role in supporting public health initiatives across the continent, and it's a pleasure to be able to offer something to IANPHI listeners and the broader continent. So on behalf of the team at the NICD and the South African Collaborative COVID-19 Environmental Surveillance System, that's the SACCESS network, I'd like to share the South African experiences with wastewater-based epidemiology for SARS-CoV-2. Before I go further, important to acknowledge the funders and the visionary leaders who supported and initiated this, including Melinda Suchard, who has moved on from the NICD, the incredibly hard work done by the team, and of course our funders, the Water Research Commission and the Gates Foundation. So I hope to share with you the beginnings of the SACCESS network, like my colleague Dennis, to share the polio environmental surveillance context, and then the move to incorporate SARS-CoV-2 testing in wastewater. I'll then share some results of quantitative and sequencing results from across the country, and then look at some specific areas of success and challenges, which areas where we're struggling with, and where we're working towards strengthening the system. And then lastly, some focus areas for 2022 and onwards. So of course, in our context, vaccine-derived poliovirus is a big concern. Like Ghana, we started with environmental surveillance for polio in 2018 or 2019. In response to WHO suggestions, and also the fact that we were processing environmental surveillance specimens for in our role as a polio reference laboratory for the subcontinent. So we had initiated a network of wastewater treatment sites in a number of urban metros, and the plan was that we then take these to these samples and process them further for SARS-CoV-2. So the environmental surveillance has been progressing well. There are 17 or 18 sites across the country. We've, like Ghana, detected the Sabin strain. We've also had one detection of a Sabin-like virus with 7 mutations, which was an interesting finding for us. Thankfully, we've not yet had CVD-PV, although we have picked up in AFP cases 2 immunodeficient VD-PV cases over the past 5 years. So, of course, we watched with interest the emerging developments on the international front of using wastewater to detect COVID, and Melinda Suchard from the Center for Vaccines and Immunology initiated SARS-CoV-2 testing using these same samples, water samples that have been submitted to our laboratory for polio testing. And we then expanded the network with funding from the Water Research Commission. So at present, we have 87 wastewater testing plants which we sample every week across the country. We have tended to focus on the major metropolitan areas, but we have representative sites across the country in all of the major provinces. So the most of our treatment plants are in Gauteng, which is most densely populated, followed by KwaZulu-Natal, and thereafter the Eastern Cape. We are also working in parallel with the South African Medical Research Council, who is doing wastewater testing predominantly in the Western and Eastern Cape area. So these are some of the results that we've had, and I'm sharing the results of the quantitative testing in the top figure and the genomic testing in the bottom figure. And just by way of explanation of these results that come from the metro area called the city of Tshwane, which is in Gauteng, in the graph on the top, the horizontal axis represents the epidemiological weeks in 2021 up until 2022, week 5. And the vertical axis on the left corresponds to the bars, the gray bars, and those represent the clinical cases of SARS-CoV that have been identified in human specimens. So we put that as a backdrop against our wastewater levels. Then the lines and dots represent the SARS-CoV-2 copies in log copies per mil, so it's genome copies per mil, mostly using the N gene, but sometimes using the ORF gene or the E gene, depending on the kit that our participating laboratory uses. You can see that the wastewater levels increased during what you see here, the third and the fourth waves. The third wave happened during the mid-year 2021, and the fourth wave over December towards the end of 2021 and into 2022. And you can see, if you focus on a specific line, for example, the orange line, that was results were taken from Klipgat, which is a wastewater treatment plant in the north of Tshwane, and the results increased beautifully and then decreased after the wave was finished. If you look at the bottom figure, again, this represents epidemiological weeks. They coincide with the weeks in the top figure, and the colored, the different colors represent the different variants of concern. So the dark blue represents beta, the light blue represents delta, and then Omicron is in orange, and C112 is in a purple color. The vertical axis represents what we call the read frequency. That's the proportion of isolates in a given wastewater sample that showed the presence of this single nucleotide polymorphism. That's a nucleotide mutation that is specific to that particular variant of concern. So when you see orange squares or dots, those are specific mutations that are unique to Omicron variant and which dominated in wastewater samples over the fourth Omicron wave. So we were able to show and to provide the health policy makers in our country, both at national and provincial level, these wastewater testing results in near real time with a 2 to 3 week, more often 2, but sometimes 3 week lag on the genomics, and a 1 week or fewer, shorter lag on the quantitative levels. So you can see in the city of Joburg, which is another high density population area in the center of South Africa, again, lovely correlation, particularly looking at the blue line there of the, in the top figure, of the quantitative levels in log copy per mil with the number of cases. And again, you can see the variance of concern, the blue, light blue at the bottom representing Delta, which dominated in the third wave, and Omicron, which dominated in the fourth wave towards the latter part of 2022. The same in Ekurhuleni, the good correlation. What you may have noticed in some of these slides is that after the end of the fourth wave, there seems to have been a slight increase in levels, and we keep tabs on the clinical genomics, which is done on patient specimens by our parallel unit within the NICD, and we were informed about the presence of a new variant called BA2, and we have our suspicions, although we are still to confirm that this increase or wave within wave after the fourth wave is due to the increasing transmission of this new sub-variant of Omicron. So these are the findings from eThekwini, which is an area on the south eastern coast, and then Bloemspruit wastewater treatment plant, and Mangaung, which is a city urban area in central. Again, nice correlation, but some suggestion of an increase towards the most recent weeks, 6 and 7. Again, the epi curves here. What's interesting to note, and we'll come to it in the challenges, is that the red line at the bottom over here represents, with dots, represents the samples that underwent genomic sequencing. And you'll see sometimes there's a genomic sequencing, a specimen that has been submitted for sequencing, but no mutations were found. And this is a source of curiosity for us. We want to know what is actually going on here, because you'll appreciate that in order to look for known variants of concern, we have to identify unique single nucleotide polymorphisms or unique mutations, and we can't do that unless we have worked closely with our clinical colleagues. And so it becomes a useful technique for the identification of known variants of concern, but when we don't have a specific variant of concern to look for, we're not sure what's going on in the wastewater. We do have complete genome sequences because we sequence all parts of the genome, and then we data mine these for variants of concern. But in these samples, we haven't picked up anything, and so it's a curiosity for us as to what is going on there. So these are really more of the same. I'm just showing what's happening in the Western Cape, the southernmost tip of our continent. We've done some correlations and found very good correlation. If you look particularly at the red rows, these are wastewater treatment plants in the Gauteng area, and there's very good correlation coefficients with statistically significant correlation between cases and admissions of SARS-CoV-2 patients to hospitals, which is a good sign. The challenge that we have faced in utilizing or creating this data is how to convince health policy makers that it was reliable. Our wastewater testing got underway during the third COVID wave, and then we were generating lots of results as the third wave ended. And by week 43, you could see that the clinical cases has reached a low ebb, and the wastewater levels also followed suit. But from week 44, we started seeing results, increasing results, and week 45, again, we started seeing increasing results. And we reported these diligently, but at that stage, many people in the health policy sector were not, can I say, didn't trust the findings, didn't know how to interpret them, and didn't know how to act. And it was made all the more difficult because the caseloads were very small in week 44 and week 45. However, what I show in this panel on the left is a map of Gauteng showing the distribution of cases, the distribution of the proportion of clinical tests that tested positive by epidemiological week. And what was evident was that the proportion positivity was increasing from around 2.5% through to 15% in the northern parts of Tshwane. And together with the wastewater results, these findings were later shown to actually predict the fourth wave, the results increased, and it was only around about week 47 and week 48 that the new variant Omicron was described first in the world from ourselves, and I mean from South Africa, from the NGS group, and we were very proud that the wastewater had picked up these increases with about a 3 to 4 week lag time. The other success that we had is beautifully illustrated here in the Free State province, where the genomics data that we report on is shown, and this is not just in Free State, but this is a nice example, is shown to correlate perfectly with the with the sequencing from clinical isolates. So you can see the key there, the color code for the variants of concern in both figures is the same. The bottom figure shows the number of isolates that have been sequenced from clinical strains, and the different color represents, in the bars, the different color represents the variants of concern. The line, which is a multicolored rainbow line, represents the epidemiological curves in the Free State with the total number of cases that are reported on the right-hand vertical axis. So you can see the colors correspond. We're picking up single nucleotide polymorphisms in wastewater that are unique to the variants of concern, which are being isolated from patients during the same epidemiological weeks. So what are the challenges that we're facing? The data that I've shown you comes, the quantification data comes from a variety of 7 laboratories across the country. And while most of us use different arrangements of concentration, extraction, and PCR methods, and it's therefore difficult to compare from one laboratory to another, we do conduct a laboratory comparison QA program, but nonetheless, some laboratories repeatedly have different levels of SARS-CoV-2 genome compared with us, and it would be important, therefore, not to compare results from one laboratory to another. There's also, of course, variation in the quantification results that may, for example, be due to rainfall, but also to flow rates. And then the other area that is important for us is the turnaround time, so that the results can be presented in good time to health policymakers. An area where we've been struggling with and are working on is at what point is an increase in wastewater something to worry about? And then a very important area is getting our results to policymakers and getting them used. And a lot of that is around helping policymakers to understand how to interpret the results and at what level can they be trusted. We'd also, of course, like the public to use our results and adapt and adjust the non-pharmaceutical interventions and vaccine uptake based on the results of wastewater epidemiology. Our genomics methodology is the area where we are challenged the most. Sometimes when the levels of SARS-CoV-2 in wastewater are low, we struggle to amplify and the genome, and that we need to look at methods to strengthen that. And then at present, our methods only work for known variants of concern, which have already been identified in clinical samples. Yet, because wastewater captures all the genetic material from the entire population, it seems to be an ideal methodology to detect signals when new variants are present, and we want to work on the methodology for that. The other area is the turnaround time on genomics needs to be speeded up in order to make the results clinically relevant and available for policymakers. So our focus areas for 2022 are to firstly strengthen our communication tools. On the right is a dashboard that is in development. which we hope will help advocate public and policymaker use of our data. We also need to develop interpretive thresholds and models that can perhaps use to predict increases. We need to strengthen the interpretation of our results relative to the population health of persons contributing to the sewer network. So we need to understand the populations that live in these catchment areas. And like our Ghanaian colleagues, we want to widen the scope of our network to include other communicable diseases such as hepatitis A, measles, influenza, tuberculosis, and antimicrobial resistance. So thank you. Our reports are available on the NICD website at this web link if you would like to access it. Thank you.
Thank you so much, Dr. Kerokan McCarthy, for such a concise but excellent presentations. So, colleagues, now we'll move on to our Q&A session. And I can see a number of questions already in the Q&A box. But I'm going to start with the question that is being channeled to Africa CDC. So the question is, what are the recommendations of Africa CDC for wastewater surveillance, and how can it be adapted to different contexts and countries? So I'll just take that question quickly. So as Africa CDC, we have a number of recommendations to member states, and I'll start. The first one is member states may wish to focus on wastewater surveillance in districts with low reporting, where surveillance and testing is suspected to be the low reporting is suspected to be the reason why the incidents currently being reported is low. That's where the surveillance capacity is poor. And this could be maybe the reason why the incidents that is being reported is low. So we kind of recommend countries to focus on such districts. And additionally, repeat negative sampling of wastewater to validate surveillance reports of low or no cases. And we know that's currently the case, in some districts where information coming in or data coming in shows that there are no cases, we could still do wastewater surveillance just to validate that information. And we also recommend that experts on environmental microbiology and wastewater systems are critical, really critical to determining the feasibility and methodology of conducting wastewater surveillance. And we also recommend that the type and frequency of wastewater testing is a function of the capacity on the infrastructure of the member states. So in this regard, we recommend that in communities where no transmission is reported, wastewater surveillance sampling should be conducted at least every 2 weeks to identify the presence of the virus as early as possible. So I would go to the next question coming in from Beatrice that states that it's thanking Dr. McCarthy and asking, do you think it is possible to overlay sewage surveillance data with non-traditional epidemiological data such as mobility data or communication network data to potentially predict trends in SARS-CoV transmission? So this question is directed to Dr. McCarthy.
Thank you, Beatrice, for the question. Absolutely, yes. Digital surveillance using communication data, social media, and then of course cell phone utilization networks is a very helpful surveillance modality in contexts where laboratory surveillance is less strong and can often be a signal for the transmission of a particular illness. We haven't tried this. We don't have extensive digital surveillance in South Africa, but I have no doubt that the two would complement each other. Over.
Thank you so much, Kerokan. So the next question is from Sophia. Did you normalize your SARS-CoV-2 concentration in wastewater to some surrogate viruses or other values like flow rate?
So thank you, Sophia. This is an area that we struggled with internally in our laboratory network as to whether or not we should do this. We did collect, in some cases, data, including the flow rate, but we have not normalized our data. This means that it is subject to environmental variation in the sewage utilization rates and in rainfall particularly. And we do have a winter rainfall season, so it may have altered our results. So yes, the answer to that question is no. It does introduce a source of error into our data. We're aware of that. And we think it is something that we should do. The problem is the availability of the flow rate data and the extent to which rainfall dilutes the data. Some of our laboratories do use cross-phage detection, and we potentially could normalize, but we don't do it as a routine using viral infections. Over.
Another question coming in to you from Damien. Thank you for your interesting presentation. For the variant detection in wastewater, do you use screening of mutations or full sequencing?
Thank you for the question. Dr. Muklet Youssef is on the call. He's our chief genomics scientist, wet and dry laboratory work. May I invite him to answer the question? Is that possibly a possibility? If not, I can answer.
Yes, sure. Maybe Maria could unmute him if he does not have the capacity to.
Yes, can you give me his name again, please?
Dr. Muklet Youssef.
Oh, I see him. Okay, he's been allowed to talk.
Thank you. Thanks, Kerrigan. So to answer the question for the variant detection in wastewater, we actually use both. So basically, we sequence the samples from wastewater using the Arctic protocol, which is the same protocol used for clinical isolates. The only difference that it does we do amplification of tailing PCR. In other words, we get in small fragments of the virus, but it spans the entire genome. The differences from clinical samples, we do not generate consensus sequences after sequencing those small fragments. We're rather looking for mutation of interest. So we have a list of mutations. Those mutations are identified to be unique to different variants. Meaning if Omicron will have a list of mutation, Delta will have a list of mutation that will not be shared by other variants. Then from the sequences that we generate, we look for this mutation in order to define the presence of the variants. So for the graphs that Kerrigan was showing, if when you see the color, the different colors, the orange for the Omicron, for example, it means that there was a mutation only found in Omicron detected in that plant in that specific epiweek. I hope I answered the question.
Yes, thank you so much. Okay, so I'll move on to the next question. And I will give this to Dennis. Maybe Dennis would want to answer this question. Have you implemented a surveillance of SARS-CoV-2 in wastewater airport? If yes, how have you used the result in a public health perspective?
Well, thank you very much for that. For our airport, actually, we are one of the few countries where we implement testing on arrival for arriving passengers. So I dare say we have a fair idea as far as COVID-19 is concerned amongst arriving passengers. And so maybe that has not driven the desire to look at COVID-19 in airport waste, because everybody above 5 years who arrives in Ghana is tested on arrival before they even leave the airport terminal. So we know the, what should I say, prevalence or incidence, whichever we want to use amongst those who are arriving. So it's not been one of the areas we've explored. But I think that when we look at wastewater surveillance beyond COVID-19, some of the pathogens I mentioned, and some are not common here, norovirus and others. So we probably would have to look at wastewater surveillance for others other than COVID-19 because of the current practices we have at the airports. But probably if we should stop testing on arrival, then I think that it's something we could potentially look at using as a proxy. Thank you.
Thank you so much, Dennis. There's another question here from Andrea. How do the public access the data? Is that data and what it means being explained to different groups representing the public?
Question for,
do you want to take it?
I was going to ask you, is it for Dennis or us? I think it's both of us.
Yes.
Dennis, go
so
for it.
You want to go first and then Dennis goes second on this question.
Okay. All right. So the only way the public can access our data is through the web link that has been shared in the chat. However, we are embarking on a more a stronger communications initiative targeting the public specifically by highlighting the current Sentinel site levels of SARS-CoV-2 on wastewater and pointing public to the dashboard. So we hope that that will contribute over 2022 to increased utilization of the data by the public, which in turn we've noticed over SARS-CoV-2 strengthens and kind of prods public health makers to take policymakers to take wastewater data or any other health intervention more seriously. We do have training sessions we have had in the past and will continue to have training sessions with the provinces to explain the utilization of wastewater and provide updates. We also share the data with our COVID incident management teams on a weekly basis. Over.
Thank you so much, Dr. Kerekan. So Dennis, you want to go next?
Yeah, sure. For us, I think that aggregated data is always available for public consumption through our various channels. So it's either through our published annual reports or weekly reports, which we usually send to the various regions and districts across the country. But more detailed information on cases, for example, on the environmental sites and the sequencing and the others, if we do them, can be provided if requested for. I know also that there are attempts to publish some of these findings in peer-reviewed journals, which obviously would then make it also accessible to others. So those are the options as far as access to the data is concerned. Thank you.
Thank you so much for those very insightful responses to the questions. And so I see we just have 5 minutes to go, and I will just be providing quick summary points that we have all discussed and come to a kind of a platter, a common platter. So looking at what has come up from the different presentation, environmental surveillance could form an integral part of polio COVID-19 eradication efforts. And there is need to develop an integrated environmental surveillance strategy that includes other pathogens like virus, cholera, salmonella typhi, and other viruses. We have also seen that experience and lesson learned on wastewater surveillance has demonstrated an opportunity in the detection of new strains of polio, COVID-19, and this could be extrapolated to other pathogens. Testing wastewater is very, of course, complex, and if done improperly will lead to inaccurate and misleading information. Therefore, there is need to look at the inclusion of experts, especially those on environmental microbiology and wastewater system, to improve on the validity of information that have been derived from this surveys. Again, going forward, there is an urgent need to strengthen laboratory capacity for environmental surveillance, develop a curated and integrated data repository, online dashboard, and to support decision-making. There is also the need to strengthen data analysis and interpretation to improve uptake by policymakers. I think this point has been reiterated by our two speakers. There's also the call to explore the development of an integrated environmental surveillance strategy that spans beyond polio and also and COVID-19 to include other pathogens, as I earlier mentioned. At this note, we sincerely want to thank our organizers, IANPHI, the chairs and co-chairs, and the sound speakers, participants, and interpreters for such a succinct but excellent discussion. You are also kindly reminded that the recording and slides will be made available over email and on the IANPHI website. I would now want to hand over to Dr. Alex and Hebe Hen, sorry if I didn't pronounce your name rightly, our chair and vice chair respectively of the IANPHI Africa Network, to provide their closing remarks. Over to you.
Thank you so much, Mercy, for that wonderful moderation. I want to thank everyone, thanking, of course, our gallant participants for attending the first webinar of 2022, and of course, thanking the IANPHI Secretariat for making all this possible. Thank you, Marie, Lisa, Andishe. It has been great. I mean, your support is invaluable. We really do appreciate everything. We want to thank our interpreters, Beatrice and Natalia, for really doing a wonderful job. To people who do not speak English, you've done a great job. I've seen comments coming in through questions and all that, and definitely you did a great job. And I want to thank our speakers for today, Dennis and Kerrigan. Your presentations have been wonderful, and I think you managed actually to convert many of the members who have listened to you today. We are definitely now converts and believe that wastewater is a useful surveillance tool for many pathogens. And the experiences you have shared and the progress on wastewater surveillance have opened our eyes. Now we look at environmental surveillance probably a little bit more differently than we had done before. So it's now incumbent upon Africa CDC to pick up from here and guide AU states, accordingly. So on this note, I want to invite Hien. Hien, are you there? To actually close the webinar for today. Hien, are you on?
I don't think I don't think he is. I think he just
okay.
dropped off.
It looks like Hien has logged off. We lost Hien. Okay,
Yes,
no problem at all. I just want to say thank you, and I want also to inform members that actually have a dashboard now for our webinars, and thanks to the IANPHI team. So we are now able actually to display all the webinars we've had, and we are going to have a series of these webinars, and we shall be communicating ahead of time so that we plan and put it on our calendars so that we attend. You've seen how useful these webinars can be. So this is just the beginning. We are going to have many more as we move forward. So thank you very much. Come on, and when we call you in subsequent seminars. Have a wonderful morning, evening, and good night. Thank you, everyone.